Hey guys, Dr. Rich here from Optimal Spine and Joint Center, and today we're going to go over lumbar traction. So I'm going to use two of my staff members to explain what we do and what this machine is actually doing. Okay, so over here we have two of my assistants, and we're going to act like Amy here has a problem in her lower back, and her lower back is a little flat, specifically in the lowest part, around L4, L5, okay? So Jay is going to help Amy into traction, and as she's doing that, I'm going to explain to you what we're doing with this, okay? So go ahead. So she's going to have Amy lay over top of this strap here, and this strap's going to be placed in those joints of L4 and L5. She's going to extend her legs, and extending her legs activates her hamstring muscles, which is why we extend the legs. So some people would say, why can't you just leave the feet down? We want to activate the hamstring muscles. Here, Jay is going to strap the lower part of the leg bones here, and what she's doing is she's locking those bones down to allow, as we start to crank into the back, the pelvis to flex, okay? So we're trying to get a lot of flexion in the pelvis here. So Jay will then move this arm on the machine down, okay? And when we're trying to get those lower back joints, we're trying to get a certain amount of angle to go through those joints. We can't just leave it straight up and down. We need to get an angulation on those joints. Think of a force of vector force going through the spine. She'll then attach this cable here, this rope machine, and then she's going to crank, and this goes to patient tolerance, okay? So what she's trying to do here, she's trying to stretch the ligaments in Amy's lower back, and as she's trying to stretch the ligaments in Amy's lower back, she'll pull this, and Amy will tell her when tight is tight and where she's comfortable, okay? So good. And what Amy will do is she'll sit in here for 5 minutes, and we'll set a timer here for 5 minutes. And then as Amy progresses, we'll increase this time 5 minutes each time till we get to a total of 15 to maybe 20 minutes depending on the case. We're trying to get as much stretch out of those ligaments as possible. All right, now she'll do this for a certain amount of sessions, and after a certain amount of sessions we'll go back and we'll reshoot an x-ray and remeasure her curve on that x-ray. So guys, we use this typically in cases of lower back pain, possibly disc cases as well. If you have any questions, feel free to contact us at 944-88-580 or optimalsj.com. If you like what you're hearing, please click like on the video, comment, tell us your thoughts, and again, you can subscribe to our videos on YouTube if you want. Thanks again, talk to you later.